Yes, welcome back to Introduction to Child Psychology Module 1, topic number 4. And this is our last topic in this model. Yes, child psychologists in applied settings. Child psychologists in applied settings. Child psychology is not just about developing theories like we have been reading about Jane Pagan. It's not about developing theories to explain development. It's also about the practical, how to practicalize what we have learned in theoretical aspects. It is about working with the children and the young people to support their lives. Are we together? Your work as a psychologist is not only, reading more about the theories of how the child developed. We're also more into the practical aspect of it by working with the children and young people to support their life. Child psychologists often work in a practical settings. They do work in a practical settings like schools. You see them in hospitals. What are they doing? They are trying to assist. They are trying to help and support development. Here we offer two examples of work in a practical setting. So when I said child psychologists in applied settings, what do I mean? Number one, educational settings. Educational psychologists, they work with the children who find it difficult to learn, understand, or communicate with others, or may have some behavioral difficulties. You have seen them in some schools, especially some of your mates that you grew up with in your secondary schools or in your primary schools, who have some kind of one or two difficulties. Some are difficult in learning. Some are finding it difficult to read. Some are finding it difficult to stay in class. Those behavioral attitude. So it's the work of the educational psychologist to come in and assist. So educational psychologists, they do work in schools. They work in collaboration together with the teachers, the families, and the school administrators. In other words, to help the children who are struggling with the specific educational issues. So they call in the child psychologist, the educational psychologist. That's the one aspect of applied setting. Number two is the clinical settings. In a clinical psychological study is to assess and to treat a wide range of biological, psychological, and social problems that the children and the young people may experience in their personal lives. Using the factors of the biology or psychological or the social problem that the children might be experienced. So in a clinical settings. And when we say in the clinical settings, we mean this might involve assessment of individual to find out what they are struggling with. Not only to find out on what they are struggling with, it's also to intervene, that intervention that supports the individual to cope with the difficulty or prevention program that can stop them from suffering. Are we together? So it's one thing to identify, it's one thing to find out, it's another thing to assist, to put some factors in places that will intervene in assisting that particular person or child to overcome that particular problem. So in a clinical psychologist also consult with other professionals to offer a holistic support structure for an individual as possible. It's for you to diagnose, to find out, and to provide an assistant or to put a prevention measure in places in order to stop the suffering from that particular child. So similar to educational psychologists, the clinicals often use the diagnostic text. Sometimes they have to go to the lab to diagnose some tests to identify children who are experiencing mental health difficulties, to be able to identify some children or those kind of children with the mental health disorders who are the risk of having some kind of developmental disorder like autism. I know if you have seen the autism child, you can tell that they are not as normal as the age group. They were so apathetic in everything they do. You see the way they shout, the way they interact with others, the way they do things are so different from the age group. Or the ADHD, or to assess the progress of the children who have suffered physical or the mental damage. For instance, if a child is being raped, they got raped, so is the clinical psychologist have to take it to the lab to run some tests to see that during the rape, is there any damage? What this lady is suffering from as a result of rape. So by understanding how the children of a certain age typically respond, so as the clinical psychologist can identify the symptoms of mental health difficulties or a developmental disorder with goal of securing children appropriate support as early as possible. So in conclusion, what we are trying to say is that this course or this module briefly introduces you to some of the main ideas that are central to the child psychology. Are we together? In your topic 1, topic 2, topic 3, and up to this topic now, what we are trying to do is just to briefly introduce you to those main ideas that are central to the child psychology, with a particular focus on early development of a child. So child psychology tries to describe and explain all aspects of child development, including changes in children's cognitive, social, and the physical development, and to understand the support children experiencing delay in their development. So some of the dominant theories we have learned about also about the individuals as against the development influenced by the wider society or the cultural environment. So finally, in conclusion, we're saying these theories often speak to answers a number of important psychological questions, which include explaining how change occurs, the role of the sociocultural environment, and how the children shape their own individual development. So this can often influence the kind of applied work that psychologists carry out, such as in a clinical or in educational settings. So we've come to the end of module 1. If you don't have it complete, please try to check the first video on topic 1, topic 2, topic 3, and this is the last topic, topic number 4, that concluded the end of our module 1. I will see you again in the module 2. Till then, you have to write your assignment, check your assignment in this page, and also after the assignment, you have to write your CA1, your continuous assessment 1, before you can move on to module 2. Thank you, and God bless.